Okay, should be live. People can mute themselves also.
Thank you. Good afternoon. Welcome to the Insurance and Pharmaceuticals Subcommittee of the Health and Government Operations Committee. We have 4 bills on our agenda today and only about 45 minutes to talk about them. I will let folks know that these are bills that have been discussed and have been worked on over a number of meetings prior to this meeting and have gained a lot of consensus along the way. We are going to start with House Bill 1337, Health Insurance Appeals and Grievances Process, Reporting Requirements, and Establishment of Work Group. This is Delegate Wood's bill. Lisa Simpson, would you tell us about the bill?
The bill expands the required contents for the quarterly report each carrier must submit to the insurance commissioner regarding appeals and grievances. The Maryland Insurance Administration and the Health Education and Advocacy Unit of the Office of the Attorney General must jointly establish a work group to study the appeals and grievance process for health insurance claims in the state and submit a report to the Finance and HGO committees by December 31st, 2024. So Delegate Woods had a sponsor amendment, which I apologize. I did not get it distributed to everybody since the last minute thing, but it would strike the work group with the understanding that we will send a letter to MIA and HEAU asking them to study the issue. It would keep the quarterly reporting requirements, but it would limit it to clean claims. I understand the chair has another amendment, and I'm not sure how all this all works together.
Delegate Woods, if you don't mind, I'm going to go right to the chair.
Absolutely fine.
Chair Pena-Melnick.
Thank you, Madam Chair, and thank you to the committee and staff for allowing me to come this afternoon. I want to propose an amendment, and it's in concept. It's pretty simple for it to be drafted and be voted on when you vote this bill today. And it's basically an amendment that says that no changes to a policy can be made mid-year that adds impediments to getting benefits that were in your plan when you signed up for it, right? It's a plan that you signed up for. It is a contract. It should be honored. It should not be changed mid-year, and it's very simple.
I move that amendment.
Second.
The amendment's been moved and seconded. Discussion on the amendment. Seeing none.
Second.
Seeing none, I have Allison Taylor. Allison, you're on.
Yeah, sorry, I might have missed it. What bill is this on?
1337.
Okay, thanks.
Okay. Matt Celentano.
Thank you, Madam Chair. I think I just have a question. Are we talking about appeals and grievances anymore? Or are we talking about frozen formulary? What are we talking about? Services? I'm just don't know how this would apply.
My understanding is it's primarily about services, but Chair, I'm going to reflect back to you. Oh. She's multitasking.
I am. It is to services, and it's related. It is the same, it's insurance, and it's very simple. It's exactly what I said. Very, very simple. Nothing more, nothing less.
So I think that the intent is that anything that was in the plan at the beginning of the plan year would continue through any of the services available, because the amendment being proposed speaks to barriers to services. So, I think, like I said, the intention is just to make sure that everything is consistent through the plan year. It could change at the end of the plan year, but not during the plan year.
And that is correct. 100% accurate. Thank you.
Okay,
Can I just
Um,
want to say, may I? So
Oh,
we'll
absolutely.
outline specifically in the bill that will say during the existing plan year. Correct, Chair Peña-Melnick?
That's correct.
Thank you.
okay, so that amendment has been moved and seconded. Any further discussion, questions? Seeing none, those in favor of the conceptual amendment, we will get the words for the voting session on in the committee, which will happen tomorrow on this bill. So those in favor, please say aye.
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 Will there be any opposition to the amendment? Seeing none, then that amendment passes. I need a motion on the
Move the
amendments.
bill as amended.
Second,
I think
Wait.
we have to move Delegate Wood's amendments.
Oh,
So Delegate Woods, you want to move your amendments?
so move, please.
Any discussion on Delegate Wood's amendments? Seeing none, those in favor, please say aye. Anybody, will there
Aye.
be any opposition to the Delegate Wood's amendments? Seeing none?
wait, remind me
oh.
what her amendments do?
They
Yeah,
take, oh, go ahead, Lisa.
Oh, no, you can, they strike the work group with the understanding we're gonna send a letter and ask them to study it. So it'll be a little less formal, but, but it will keep the reporting requirements, and limit it to clean claims.
Okay, does that help, Delegate?
Yes, thank you.
Okay, those in favor of the amendments, please say aye.
Aye.
Any opposed? Seeing none, can I have a motion on the bill as amended?
Second,
Okay, bill, on the bill as amended, any discussion or questions? Seeing none, those in favor, please say aye.
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 Any opposition? Seeing none, the bill passes unanimously. Okay, thank you all for that. Thank you, Madam Chair. We're going to go to House Bill 1056, State Board of Pharmacy Prohibition on Discrimination Against 340B Drug Distribution. This is Delegate Guzzoni et al. Lisa.
So we've discussed this bill, I think, a couple of meetings now. As introduced, the bill prohibits a 340B manufacturer, wholesale drug distributor, third-party logistics provider, or their agent or affiliate from directly or indirectly denying, restricting, prohibiting, discriminating against, or limiting the acquisition or delivery of a 340B drug to a pharmacy on behalf of a covered entity, with specified exceptions. So there are 3 amendments that have been distributed. 2 of them you've seen a couple of times now, and they're the same. That would be Amendment 1, which is 643-226/6, that clarifies that the provisions of the bill only apply to 340B manufacturers, but that an investigation of a violation of the provisions of the bill may include a wholesaler or third-party logistics provider. Amendment number 413123 clarifies that alleged violations committed by a person that is not licensed or permitted by the board will be investigated by the Consumer Protection Division of the Attorney General. No changes to that one. The third amendment, amendment number 943926/1. This is the reporting requirement. It's a little bit different this time in that it requires, well, first, it requires the Prescription Drug Affordability Board to take the lead on the study. And then it adds in looking at the finances. I don't know if Andy York is here or not, but he did send in to me an email a couple of hours ago saying we might want to add one more provision to that reporting requirement, and that would be to study how the plan is implemented in the state now.
Lisa, how is that different from the implementation and impact?
It would be how it is now before the bill is implemented.
Oh, I see what you're saying. Okay. Questions, Delegate Shalega?
Thank you. I have two questions. Number one, I'm assuming we're working off of the reprint that's dated today at 12/18. So thank you, Lisa, for doing that. I'm assuming all those amendments you just read are incorporated into that. So on page 4 of 4, the fine, which is in line 17 of 50,000, seems a little bit high. You know, I'd offer an amendment to take that down to something that's not quite as punitive as 50,000.
Do you have an idea?
I mean, I'd just take a 0 off the end, could be 5,000.
And so this application is, okay. Discussion on that? Would there be an objection to taking the penalty down to 5,000? Because these are going to be Maryland entities that are going to be subject to this, right, Delegate? So, Steve Weiner?
Yeah, it was the penalty 5,000 per incident of restriction, or is that sort of one fine for one manufacturer for the year? I think it's per incident, correct?
Yeah,
Like, what page are you on again? Sorry.
on page 4 of 4, line 17, 50,000 per violation is what it says, Steve.
In the reprint.
Yeah, I mean, I just don't know how they define a violation. I wish I knew better, but if it was every time a manufacturer restricted it, I can't imagine people would have a problem with it. If it's a violation that's once per year, I mean, that's pocket change. So but I'll leave it at that. So.
Delegate Shalega, are you?
Yeah, I would press to, I think 50,000, especially since we're not really clear on what this is. I mean, it's sending a message, you know, this is a violation. And maybe I'm just thinking with my brain that thinks $50,000 is a lot of money. I still think $5,000 is a lot of money, but you know, that may be adequate to get the point across.
Okay. Delegate Johnson.
Thank you, Madam Chair. I think the money part's really not what we need to clear up. It's the violation per violation. Like Steve said, if it's per year, that's not a drop in the bucket at 50,000.
Yeah, if I may, just the language on line 20 clarifies what a violation is. It says violation committed by a person licensed or permitted by the board, imposed discipline intervention. No, I'm sorry, line 24. Each package of 340B drugs subject to a violation. So, you know, if a company sought to purchase, or I'm sorry, to have delivered to its pharmacy, you know, a bottle of 100 pills, that's a single violation, just for clarity. And I don't speak on behalf of the covered entities, but what the delegate proposed to me seems, you know, I've seen it in other states, seems reasonable.
You're talking about the 5,000?
It's not my decision at all, but
okay.
You know.
Delegate Shalega, did you want to move that?
Yes, I move an amendment to strike 50 and make it 5,000 on line 17.
Is there a second?
I second it. Second.
Okay, got a second. Any further discussion on that amendment? Hearing none. Is there all those in favor of Delegate Shalega's amendment, please say aye.
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 Any opposition? Seeing none, we changed it to 5,000. Okay.
I had another question. That's why I left my hand up.
Okay. Delegate Shalega.
So the study language that I see in the reprint, I'm not sure it's going to get us back all the information that I think we need to look at the 340B program from the manufacturer to, then it goes to either a PBM or a hospital or both, and then it goes to a pharmacy. I think I'd like to know a little bit more about that. Again, to ensure these drugs are getting to the people we want them to get, to the people that Steve services, these important HIV drugs and people who really need them at a discount. So, and maybe Lisa could weigh in and let me know if this study language is really going to get to that.
Before I go to Lisa on that, I'm going to go to Delegate Gazzoni, who's been waiting patiently on her bill.
Thank you, Madam Chair. I just wanted to mention that it was shared with me that there was a law passed specifically with regard to PBMs and 340Bs, I think a couple of 3 years ago. And so I think that there's a sense that that's already handled, closed some of the loopholes and challenges with regard to 340B, maybe taking advantage. Lisa may have more information on that.
I don't have more information. To answer your question, Delegate Szeliga, I mean, it's pretty broad language to look at the finances of the program. And I know there have been concerns expressed about the reinvestment. So I specifically included that. If there is other things you would like included, I can always add that.
All right, thank you. And Lisa, we really do think you know everything.
I definitely do.
Yes.
I wish I did. Really do.
I'm just grateful for everything she knows. Delegate Taveras.
Thank you, Madam Chair. I just want to get clarity on whether we've addressed the Delegate Johnson's concern with regards to the definition of violation. Because I understand, I'm sorry, I have some folks, I have a lot of noise outside, so I wasn't able to hear very well. If that point was resolved, I know that we lowered the fine to 5, and that
Delegate,
was voted on, and we voted on that.
If you look at lines 24 and 25 of page 4 of 5, it literally says that, every package that is delivered is a violation, that incorrectly is a violation. So it would be $5,000 per package. So a bottle of 100 pills would count as a violation.
Okay, so that's,
okay.
Got it. All right, that was the answer. All right, thank you.
Okay. Delegate Kipke.
Thank you, Madam Chairman. Delegate Szeliga, it brings me great joy to reference House Bill 1274 of 2022, which was a bill titled Prescription Drugs, PBMs, Federal 340B Program. And we took care of that problem. That was signed into law. Thank you.
You're the man. Thank you.
Hey, whose bill was that?
Thank you for that information, Delegate Kipke. I appreciate it.
Yes, that's very helpful. Thank you. So do I have a motion on the amendments that we've brought before you?
Move favorable.
Okay, a second?
Second.
Any further discussion on the amendments? Okay, those in favor of the amendments, please say aye.
Aye.
Any opposition? Those, okay, do I have a motion on the amendments pass? Do I have a motion on the bills amended?
Move the bill.
Move the bill, please.
Second.
We have a motion and second. Any further discussion on the bill as amended? Seeing none, those in favor, please say aye.
Aye.
Any opposition to the bill as amended? Seeing none, it is unanimous. Thank you all very much for the conversation. Thank you, Delegate Szeliga, for your input. And we will go to House Bill 932, Utilization Review Revisions. And that's me. Lisa, would you like to speak to this bill?
This bill alters and establishes requirements and prohibitions relating to health insurance utilization review and prior authorization, the process used by carriers to determine whether a requested healthcare service is medically necessary. It alters requirements related to internal grievance and adverse decision procedures and establishes requirements on payers and healthcare providers relating to the provision of patient benefit information. The bill includes provisions to increase transparency and communication during the review process. And among other requirements, a carrier must state in detail when denying a healthcare service the reasoning as to why the service was not medically necessary and why it did not meet the carrier's criteria and standards. There are amendments that alter a provision relating to prescription drugs and reauthorization requirements. The amendment will require a carrier to allow a patient to remain on a prescription drug if it's for the treatment of a mental disorder, was previously approved by the carrier, and the prescriber attests that the drug continues to be necessary to effectively treat the patient. And the amendments require the Maryland Healthcare Commission to monitor and report on progress toward implementation of electronic prior authorization and real-time benefit check technology, instead of establishing a work group.
Okay, thank you, Lisa. So I just want to remind folks, this is a bill where we brought together all of the stakeholders. We worked on this throughout the interim, and we ran into issues, and we were all ready to go. We thought we had a red bow on this bill, and we ran into issues with the fiscal note, which, if you recall, was around $93 million. And we all know the fiscal constraints these days for the state. So what you have before you is a compromise that gets us the ability to do all of the great things that are in the bill on both ends, whether it's the appeals and grievances, to building our technology or using the technology to facilitate the process that helps with making sure that folks are able to get their medications and in a timely fashion, and also helps the providers use the technology effectively to be very quick. So that's the real-time benefits. So with that, I would like to move the amendments. Do I have a second?
Second.
Okay, it's moved and seconded. Delegate Taveras, did you want to speak, or you just didn't take your hand down yet?
Oh, no.
Okay.
I was just gonna approve.
Okay. Any discussion on the amendments or questions? Seeing none, those in favor of the amendments, please say aye.
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 Those opposed, any opposition to the amendments? Seeing none, the amendments pass unanimously. Do I have a
Move the bill.
motion on the bill
Second.
as amended?
Second.
We've got it. Any discussion? Delegate Shalega.
Thank you, Chair Cullison, and thank you for all your hard work. This is such an important issue. And I'm reading through the 32-page reprint. Thank you for providing that for us, Lisa. I'm assuming, and I haven't probably gotten there yet, we've included services in this pre-auth as well, not just pharmaceuticals.
Yes. Yes,
And
they're
did we shorten up the time so that the carriers must respond with a denial within a certain amount of time?
in an emergency situation, it's 24 hours. In a non-urgent situation, it's 72 hours.
Oh, wow. Wow. Okay, that's substantial, because right now there really isn't a time frame, is there?
Oh, you froze. I hope you're sort of freezing.
You were I was probably me. I said that right now there currently isn't a time frame, is there?
Now they were striving to do it as quickly as possible, but now there are guardrails around it, and it will happen. I suspect it'll happen in less than 72 hours most of the time, particularly when the providers are using the real-time benefits program.
Okay. All right. That is really great news for patient care. Thank you.
Delegate Taveras.
I hope we could eventually add massage therapy to this. But I'll leave that alone after MHCC.
I'll sign up for that. Okay, seeing no further discussion, I want to All those in favor of the bill as amended, please say aye.
Aye.
And will there be any opposition to the bill? Seeing none, the bill passes unanimously. I just have to say again how much I appreciate the work of the provider advocacy, and especially Dana Kaufman and the insurance carriers. Matt Celentano was the lead there. You all did. We really appreciate you coming together and working on this bill, and we hope, we can even improve on it in the future. So thank you. Okay, our last bill of the day. We are doing really well on time. Thank you all for being very concise. House Bill 876, Health Insurance Pharmacy Benefit Managers, Specialty Drugs Dispensed by a Physician. This is Delegates Johnson & Johnson. Lisa.
As introduced, the bill prohibits a pharmacy benefits manager that provides pharmacy benefit management services on behalf of a carrier from requiring a beneficiary to use a specific pharmacy or entity for certain specialty drugs. The prohibition applies if the drug is dispensed by a physician, used in the treatment of a chronic, complex, rare, or life-threatening medical condition, and is injected or infused. For a specialty drug that fulfills these requirements, a PBM that provides pharmacy benefit management services on behalf of a carrier may not reimburse a pharmacy or pharmacist in an amount less than what the PBM reimburses itself or an affiliate for the same specialty drug. And so there were some amendments, I think, that got distributed. They're not in amendment form yet. They were worked on by the advocates for the bill and the carriers, and if they're here, probably.
Did members of the subcommittee get the draft amendments? So the draft amendments, what they do is limit this possibility to, or this program to oncology related drugs, and assures that the amount being charged, the cost of the drug and the reimbursement for the drug is exactly the same as it would have been if they had used the person's regular insurance program. So there's no, this bill has been before you. Delegate Johnson, if you don't mind, I'm going to expound a little bit. At least 4 times. This committee has seen this bill at least 4 times in various fashions. Over the interim, there was some work on it. The chair and I visited the oncology center that was initiating this bill. They made a compelling case over why they should completely change the distribution of these specialty drugs in order to meet the immediate and urgent needs of cancer patients. All right, so I want to be really clear. This was about making sure that cancer patients had the medications that they needed on time in order to complement their chemotherapy and at the right dosage, because what they explained to me and what you saw in the hearing is dosages during the chemo process change frequently. And it's very difficult for the regular service of the PBM pharmacy to do those kinds of changes in rapid succession. So there was a lot of wasted drugs. I mean, we're talking, I saw at the end of the table, I think it was $300,000 worth of wasted drugs. So that is why you have the amendments before you. I will say, as I said, you all know a little bit about how pharmaceuticals are purchased and dispensed, purchased by the pharmacy and dispensed, and what the rules and which is all very highly regulated. This is going to change that process. And my interest is in, let's see, I know that there's an interest in expanding this beyond cancer-related drugs. My interest at this moment is to keep it narrow so that we can see how it works. and let's let it operate, and then we'll, because there are many different parties involved in this implementation change, and we don't know how it's going to work. We don't know exactly how it's going to be regulated. So my interest is keeping it clean. Delegate Johnson, do you want to say anything else now that I've gone on and on?
Well, thank you, Madam Chair. Well, we know how it's not working to the best interest of the patient now. So I think this is a good compromise. It'll be a lot more rapid response time for the patients to get their medication with no delays when there's medication dosage changes. So with that, I would definitely like to move the bill today.
Right. Okay, so Delegate Johnson, would you like to move those amendments?
Move the amendments, Madam Chair.
Okay, do I have a second?
Second.
Okay, moved and seconded. Now I'll see some discussion. Kayla McDonough.
Well, yeah, and I mean, it may not be necessary, but just a little bit of clarification on behalf of the Maryland Oncology and Hematology practices here in the state. So I think as the bill is amended, it applies the oncology specific treatment provision to the services that the provider is of the provider as opposed to the drugs. And that was something that was a little bit of a question for us, because in treating cancer, we use a variety of treatments and drugs, some of which are indicated for cancer and some which are indicated to treat side effects almost as a result of cancer treatment. I believe as it's drafted now, it would include, you know, our providers as they're treating cancer and in alignment with that treatment plan, as opposed to being drug specific on that point. And that is very helpful for us in how we would comply with the bill. So I appreciate the work on it. And I think that gives us a lot of clarification about how that cancer only narrowing would work in practice. Excuse me.
And thank you, Caitlin.
Running out of steam. Yeah.
Yeah, right. Yeah, I know how that feels. But I really thank you for your work on this.
Thank you.
Dana Kaufman.
And I just have a clarifying question, which I think you answered, Delegate Cullison, but I'm just going to ask it again. So this drug in the language, it pertains to a physician or an individual who is treating cancer. So it doesn't have to be per se an oncologist, but if it's a urologist who's treating cancer and has the dispensing, they fall under this, correct?
That
was what I thought was the.
I'm gonna go to Kim Robinson to clarify that. Kim?
Coming off mute.
Okay.
Thank you, Delegate Cullison. I believe the language that is in the amendment before you specifically says medical oncology. But I have to, I'm on the device I'm looking at you on, so I can't pull up the language in front of me to see the full.
It does say that. It says
the
dispensing provider
is a medical oncology provider.
Medical oncology
provider. So
oncology practice. Yeah, provider rather. Thank you.
So it would not necessarily extend to other specialties that we're treating, although Mr. Cooney has an opinion, and so I'm going to look to him.
I think we would, for that, thank you, Madam Chair. I think for that particular item, we might have to think about that. It does say oncology provider, so I don't know that would include the providers that Dana had mentioned, but I just actually wanted to weigh in real quick and say, you know, we just saw this amendment like shortly before the committee meeting, and we do have some technical concerns. In the amendment here, the citations and the cross references appear to be incorrect. They appear to be referring to laws that are not related to this issue at all. So we just want to make sure we have a chance to weigh in and make sure we get those corrected.
Okay.
Delegate Cullison, I would for Mr. Cooney, I'll be happy. I'll reach out after so we can talk through the cross references. I had the pleasure of working closely with Ms. McDonough on the language, so we're happy to make any technical corrections that the MIA desires.
Okay, so I'm sorry, Caitlin.
Well, and I apologize because just because I've been working on both the House and Senate sides, I do think there's some numerical things too that they may have that legislative services may have a fix on for that part of the bill, but we'd have to incorporate the oncology language. I will note on the previous question, so how we were interpreting the bill, and obviously we can talk afterward, would be that if an in-network physician who's providing oncology services could, seek reimbursement for the treatment related to those oncology services. So for example, my oncologist also treat non-cancer patients. Those would not be included, as this would be cancer specific, but for their cancer patients and those treatment plans, they would be. And our understanding is that would extend to perhaps, because I don't know that you necessarily put yourself as an oncologist, but to the extent you're providing oncology services, it would be covered, and that's, kind of be included in that prior auth and all the processes you go to seek reimbursement, but not for non-cancer treatment. So everything would be in that aligning under our physician's dispensing permit with the cancer treatment.
Yeah.
If that's helpful.
Okay, we're going to get clarity on that point, and we're going to work through the technical issues. I would, depending on how much change there is, if we need to meet again, are there any other issues that are outstanding? And let me ask, as in the 6 minutes we have left, is there anything else that we need to talk about on this bill? Because if the changes are not really significant, we'll take them to the full committee. But if we need to come back to subcommittee, then we'll need to find time tomorrow to do it on this bill. So I don't, Kim, did you just not take your hand down, or you have more to say?
Down. Thank you, Delegate Carlson.
Okay, then that's the plan. We'll get some clarity around Caitlin's question on who this really clarify who it applies to. We'll get the technical changes made that MIA is needing, and Lisa and I will make an assessment about whether or not we need a subcommittee or whether we can take it to the full committee. If that works for folks, then we have completed our work for today. Thank you all so much. Keep your roller skates on. We are back on the floor in 16 minutes. Thank you all. This meeting is adjourned.